Hello, everybody. My name is Hildegard Büning, and I'm the current president of the European Society for Cell and Gene Therapy. The European Society for Cell and Gene Therapy, so ESGCT, is a non-profit organization dedicated to education and science in the area of gene and cell therapy and vaccines. And I would like to welcome you today to our second e-seminar. We do have launched an e-seminar series on emerging topics. And of course, the emerging topic at the moment and hot topic is, of course, the COVID-19 pandemic. And those of you who were listening last week, we had there Dr. Jin speaking about insight into the coronavirus. His talk is still available on YouTube, and I invite you to listen to it. And today it's my absolute great pleasure to welcome Daniel Lucey, and he will speak about the COVID-19 pandemic. And Daniel is an infectious disease and public health physician who has taught about epidemics for the last 17 years at the Georgetown University in Washington, D.C. and around the world. And what is absolutely cool for us, and I think for all of you, is that he has a huge experience in really judging and speaking about pandemics, as he has traveled to epidemics every year since 2003. So we saw SARS, influenza, MERS, Ebola, Zika, yellow fever, and plague. So we are really looking forward to his talk. And as you see in the next slide, please, we invite you to send your questions, which I will then later ask to Daniel. So Daniel, the stage is yours.
Thank you very much, Dr. Hildegard Büning, and I really appreciate the invitation to be here this morning or this afternoon. Thanks to the European Society of Gene and Cell Therapy. So in my presentation, I'd like to do this brief overview in terms of my own career. I'm quite old, so I started working in the hospitals in 1982 after medical school and beginning of the AIDS epidemic before the HIV virus was discovered in 83. This was in San Francisco, where we had many patients with AIDS. I say we hadn't discovered the virus, but the virus had discovered us. And as Hildegard mentioned, that I've been very fortunate to be able to go to many outbreaks and epidemics overseas every year, several times since SARS in 2003 in China and Toronto, Canada. The second part of the presentation, very briefly, I'd like to offer an update from the wonderful presentation by Dr. Jin from University of Hong Kong last week, where the Director General of the China CDC in Beijing, Dr. George Fu Gao, on May 23rd, made the statement that the Wuhan seafood market is in fact not the origin of SARS coronavirus 2 or the COVID-19 pandemic. And finally, mostly what I'd like to focus on today is the COVID-19 pandemic in the United States, and a term that I've just made up, created, is a spell on America. Spell being the acronym that I'll talk about, standing for SARS coronavirus 2, protesters, economy, lockdown, and looters. And finally, I'll be very happy to take any comments or questions. In terms of background, I was fortunate to be able to go to Hong Kong during SARS in the spring of 2003, where I was very impressed by the culture of safety, if you will. Everyone wore masks everywhere, including at public and restaurants and shopping. This picture here on the left. And then I was very fortunate to be able to go to Guangdong, Southeast China, where the SARS was thought to have started. This was a little bit later in 2003. In September, I met with physicians there at the Department of Infectious Diseases at Sun Yat-sen University. The physician on my left in this picture actually had gotten infection with SARS and was very, very sick, but survived. And the physician on my right is a friend now since 2003, Dr. Wu, who's from Hong Kong. Looking back over the years since 1982, I would argue that what is past is prologue, and that past epidemics should help prepare for future epidemics. So after going to Hong Kong in the spring of 2003, I was fortunate to be able to go to Toronto, Canada, to work in a SARS-designated hospital, Scarborough General Hospital, where I learned how to wear personal protective equipment when working in the intensive care unit on the weekends. And that personal protective equipment, or PPE, came in very handy 11 years later when I was able to work with Doctors Without Borders, or Médecins Sans Frontières, MSF, in Liberia, in Monrovia, with the MSF treatment center, the tents called Elwa 3 in Monrovia, with one of our young patients who survived, although his siblings and his parents died. And similarly to SARS coronavirus pneumonia, the MERS coronavirus pneumonia obviously has been recognized since 2012, and unlike SARS, continues mostly in the Arabian Peninsula, mostly in the Kingdom of Saudi Arabia, but also in nearby countries in UAE and Qatar and elsewhere. And then one large outbreak in South Korea that we know about from 2015. And I was fortunate to be able to go and work with colleagues from Qatar in Hamad General Hospital in the capital in Doha in 2013 in this picture. And putting together many or most of the outbreaks that I've gone to, specifically the ones that are viruses and that come from animals, so-called zoonotic diseases, or One Health, as a unifying theme, that is human health, animal health, and environmental health. In 2014, on the way to Sierra Leone to work before Monrovia in Liberia with patients who have Ebola, I proposed an outbreak at the Smithsonian Museum of Natural History here in Washington, D.C. on the Mall, to have a big epidemic exhibition. And I'll just say that it wasn't initially embraced, but then soon after it was, when the Ebola outbreak was recognized to be as bad as it was, and then the Zika congenital syndrome epidemic was recognized. And so the exhibit opened in 2018, May 18th of 2018, and of course it's closed now during the epidemic here, the pandemic of COVID-19, but it will reopen until the end of 2021. And I hope that COVID-19 will be added to it and it will be extended longer. So in keeping with the tradition of every year going to epidemics, I was very keen to go to China for the COVID-19, before it was even called COVID-19. Unfortunately, I wasn't able to get there in January, but I went over in February 11th to Hong Kong and Shanghai, and then later to Cairo in Egypt from Shanghai. But my main goal was to go to Wuhan to work in the hospitals there with Chinese colleagues, but it simply wasn't possible to go to Wuhan. It was closed down, obviously. I hope to be able to get permission from appropriate colleagues, I'll say, in Beijing, but it was absolutely not possible. Diplomatically, I was very fortunate to be able to communicate with Dr. George Gao, who I'll mention again in a minute, the Director General of the China CDC, Centers for Disease Control in Beijing, when I was in Shanghai to request permission to go to Wuhan. But he very diplomatically told me that simply wasn't possible without coming back to Washington and going to the Chinese embassy and filling out the paperwork to go to Wuhan to work. So I thought that was very, very diplomatic of him to say basically, no, you can't go. In the picture you see here, I'm meeting with 3 physician colleagues in Hong Kong, all of whom worked during 2003 with SARS, patients who had SARS, and now all 3 are working with patients with SARS coronavirus 2. And then when in Shanghai, I was able to talk with some folks and learned quite a bit of information from sources that were only that were public, but only in Mandarin and not in English. Or if they were in both English and Mandarin, they were more detail in Mandarin. So that was very helpful to be there on the ground, which is what I've always tried to do, to go to outbreaks to understand them better and to contribute in whatever way I can, whether it's patient care or or exchanging information. So moving on to the COVID-19 epidemic, I've been following this since the night of December 30th in the US, so December 31st to probably morning in Europe and in China. I first heard about it with regard to the doctor, one of the 8 doctors or healthcare workers, I believe, Dr. Li Wenjiang, who had sent out a Twitter or Weibo account in China warning colleagues about a potential SARS-like contagious pneumonia. Again, this was in the last week of December. And then I started following with colleagues in Hong Kong and the Department of Health, their Center for Health Protection, or CHP, webpage. And immediately on that same day, December 31st in China, they began to post information about this still unknown pneumonia. And communicated with friends that I've worked with in Hong Kong over the years since 2003, going back almost every year to visit with them and talk about epidemics that I've been to and sharing information with colleagues in Hong Kong. So the question of the origin is always an issue for me about every epidemic. I try to understand it. I did that with SARS, and that's why I went to Guangdong, the picture I showed. And in MERS, I spent about 6 months in the Middle East in 2013. Including in Jordan, where the first known outbreak was of SARS in April of 2012 at a hospital, Zarqa General Hospital in northern Jordan. But the cause of that outbreak wasn't known until retrospectively the virus was discovered from a patient in Saudi Arabia, a sample being sent to Erasmus Medical Center in the Netherlands, and the virus isolated and identified, and a test became available quickly, and then it was performed retrospectively on stored specimens from Jordan, the head nurse of the intensive care unit who died, and one of the patients, a young man, 25 years old, who also died, and blood was saved. So my point is that sometimes it takes months to understand when and where an epidemic started. Sometimes with regard to HIV, for example, it took many decades. So for me, a natural question was, where did the SARS coronavirus 2 and the COVID pandemic start? So as you all know, there was a lot of discussion about whether it was from a specific seafood market. But in January 24th, in the Lancet, that paper was published on Friday morning about 14 of the 41 initial cases who were sent to a referral hospital in Wuhan had no exposure to that market. And 3 of the first 4 in particular had no exposure to the market. And so I wrote something on the Infectious Disease Society of America, a brief commentary that's shown here. It's the 6th one that I'd written starting on January the 6th, because to me this was quite an alarming situation as far as a new pneumonia that, although initially it was said not to be contagious and not to affect healthcare workers, unfortunately that turned out to be not the case. So I started writing things on January 6th for the Infectious Disease Society of America, which many American infectious physicians belong to, but also a number of infectious disease physicians from around the world, including in Hong Kong, including in Europe, including in Qatar and Jordan, elsewhere in the Middle East, and South America, Peru, and elsewhere. And as a result, the next morning, Sunday morning, January 26th, a journalist well-known from Science magazine, John Cohen, called me and did an interview about my thoughts and what I'd written, and he wrote it up and then posted it on Science that night at 11:25 at night. And then the next morning, and basically the title was that the Wuhan seafood market, as you can see in this slide on the right, Wuhan seafood market may not be the source of the epidemic. So I got many emails that next morning from many places around the world. John Cohen didn't tell me he was going to post this interview that night, but of course it's fine that he did, and got a lot of interested and curious emails the next morning from various places around the world in the United States. So to fast forward, there's been a lot of discussion about the seafood market. To my knowledge, there hasn't been any public report about what animals were tested in the market. There's information about environmental testing. 33 out of 585 samples were positive for the virus. But there's not been, for example, what I think would be helpful is a sort of a map of the market, like a blueprint, if you will, to show where the environmental samples were positive and also where the people who tested positive, where they worked within the market, because it's a very big market, something like 600 separate areas or stalls where the vendors sell not only seafood, obviously, but animals as well. And then information about the animals that were tested, but that hasn't been published to my knowledge anywhere yet. So I was quite surprised, but in a way happily so, when I read in the South China Morning Post, which I've subscribed to since 2003 in SARS and pay close attention to when there's outbreaks. And it quoted Dr. George Fu Gao, again, the Director General of the China CDC, as you can see on the slide, basically saying that we first believed the virus originated in the seafood market, but now it looks like the market is just another victim. The virus was present before the infections happened in the market. So to me, this is such an important statement that and it was presented approximately during the time when the annual meeting of the National People's Congress was occurring in Beijing. And so I thought it was, first of all, very, very important to verify that this was a correct, accurate quote. So I, again, contacted Dr. George Fu Gao, and fortunately, because I know it's extraordinarily busy, he did respond, though, and said that, yes, he was quoted accurately. And I asked him if there was evidence that he was going to present or could share about how this conclusion was reached, that the seafood market is not the origin. And again, very diplomatically, he said that there's no data he could share at this time. So I hope that there is information, a publication that comes out soon explaining how this conclusion was reached by China CDC, that the Wuhan seafood market is not the origin. I do just want to add, before I move on now, that in my view, the overwhelmingly likely source of this virus is a naturally occurring infection from animals, whether it's bats, pangolins, some other animal, like we heard last week from Dr. Jin. There's suggestion that perhaps the virus or viruses from several, at least 3 different animals, recombined in order to form the SARS coronavirus 2 that's causing the pandemic. I personally do not think that there's any evidence for the virus having so-called leaked or come out from a lab, whether it's a lab in Wuhan or anywhere else in China or anywhere else in the world. I just wanted to make clear that's my thoughts and my understanding. So moving on more now to COVID-19 in the world, the pandemic. This is a picture that I took from yesterday's World Health Organization COVID-19 dashboard. And it shows that over approximately 6.4 million cases laboratory confirmed worldwide. Almost 3 million are the Americas, over 2 million in Europe, 500,000 in Eastern Mediterranean, and now over 108,000 laboratory confirmed cases in the continent of Africa. I'd like to emphasize that these numbers are laboratory confirmed cases. So in my opinion, I think that there have been many more cases than have been laboratory confirmed because of inability to do the lab tests, in some cases false negative tests or inadequate specimens that were obtained. But I think the main reason is because, as we all know, in really every epidemic, the number of laboratory confirmed cases doesn't represent the true incidence and prevalence of the disease. So now for the part that I'd like to focus on, primarily in this presentation, and that is the epidemic within the pandemic, if you will, in the United States now. And I'd like to present some context. I am an infectious disease and public health physician, but events over the past few weeks in particular, and even the past few days here in Washington, D.C. and elsewhere in New York City, where I have a family who live and friends in the West Coast and in the South, and also have family. I think this is a unique time in the United States in my lifetime. I lived in Washington, D.C. for 30 years since 1990, and elsewhere for 35 years. So providing that personal background and context. So what I've titled this is a spell, quote unquote, spell, S-P-E-L-L, on America. And it's a term I've simply made up. And as I mentioned earlier, it would be an acronym because I think it's very important to consider the reality of this pandemic really around the world, but really should only speak for my own country, I think, in this regard at this time. But the pandemic is much more than just the virus. And I think we've seen that in many places so far. I think it's going to be emphasized and illustrated, and already has been, but it's going to be even more so in the coming days and weeks in the United States, and perhaps months. So by spell, I meant the S is for SARS coronavirus 2, P is for protesters, E is for economy or economics, L is for lockdown, quarantine, and L is for now looters, which we've seen a lot of just in the past few days in the United States, all of which impact the COVID-19 pandemic in the United States. In addition, the P could stand for pandemic, could stand for president, could stand for a lot of things. But what I want to emphasize, you can see here in the middle of the screen, that this pandemic is occurring in the United States in a presidential election year, which happens every 4 years. And it's only 5 months away, the election, November 3rd of 2020. So 5 months from today. And I think it's somewhat similar to every country in the world, but the importance of the presidential election 5 months from now, I think, has a significant role to play in terms of the COVID-19 pandemic in the United States, what's happened up until now since January, and that what will continue to happen through the election on November 3rd, and then the following January 20th of 2021 in terms of the inauguration of the president, whoever wins the election in November 3rd of 2020. So this is a graph from the U.S. Centers for Disease Control, headquarters in Atlanta, Georgia. This is from yesterday, the new cases by day in the United States since the beginning of the outbreak. And basically on the y-axis, you can see the number of new cases. It's by segments of 5,000. And then the x-axis is time. So yes, there were some cases diagnosed, a very few number, before you start seeing the blue bars and the vertical axis. But again, because the number of new cases on the y-axis is by 5,000, you can't see the individual initial cases. So you start seeing cases on this graph in the middle of March, then a marked increase. And still, there are many cases that are occurring every day here. And the concern, among many concerns now in the United States, is that there will be new spikes in the number of cases related to the protests and counter protests and looting. And these events are occurring at almost exactly the time when all 50 states in the United States, and then Washington, D.C., which of course is not a state, it's a city, but not a state. All 50 states had just started to reopen or to come out of lockdown. In fact, Washington, D.C. waited until last Friday to start to open up. So restaurants were going to open last Friday, but only if you're sitting outside. But events have occurred now that have led to just the opposite reality. So for example, last night and the night before, there was a curfew in Washington, D.C. So by 7 o'clock at night, everyone had to be off the streets, and restaurants, of course, were closed. So the reopening in DC really has not occurred, and it's changed also in most of the 50 states, even though the reopening started. So this is another slide from the U.S. Centers for Disease Control, updated as of yesterday, June the 2nd, showing the total number of cases in the U.S. is 1.8 million, including almost 15,000 new cases over the previous day. In terms of deaths, again, laboratory confirmed deaths, 105,157, with 761 new deaths just in the previous day. As a physician, healthcare personnel, healthcare worker, I'm biased, I think, towards paying closer attention to the numbers that you see on this screen. Again, this is an update from yesterday, June 2nd, from the U.S. Centers for Disease Control. The numbers are updated every day on the U.S. CDC COVID webpage. And this is the number of cases and deaths among healthcare personnel. And what I'd like to emphasize is that these are simply the numbers that we know of. Again, not only laboratory confirmed, but the number of cases for which the appropriate paperwork was completed of the many people that had laboratory confirmed cases. If it wasn't designated whether or not the person was a healthcare worker, then they would not have been counted here. So basically 67,113 cases among healthcare personnel, but that represents the known cases out of only 310,530 people that are laboratory confirmed. And similarly, the number of deaths, 321, is certainly an underestimate of the total number of cases of healthcare personnel. And this is, I think, as large a number of cases of COVID-19 in healthcare personnel as in other countries in Europe, for example, in Italy and Spain, the UK. Although I haven't seen the World Health Organization or OMS having these numbers from around the world, from countries around the world in terms of healthcare personnel specifically. I might have missed it. I've looked for it several times, communicate with WHO about whether that information is being gathered and posted, but again, I've missed it. But in China, there are approximately 83,000 persons altogether laboratory diagnosed with SARS coronavirus 2, and about 4,600 deaths. The China CDC reported way back in February 17th in the China CDC weekly publication that there had been about 3,019 healthcare workers, of whom 1,716 were laboratory confirmed. So there will be more laboratory confirmed cases among healthcare personnel in the United States as time goes on and the reporting becomes more complete, if you will. And unfortunately, as the epidemic continues, in my view, it certainly will continue in June, July, August, in parts of the Northern Hemisphere, but certainly in the United States, in my view. And so the number of cases, the number of deaths will go up in the country, including in healthcare workers. So in terms of the economic damage that this pandemic has caused really around the world, But in the United States, since the pandemic was first recognized, there's been over 40 million Americans who filed for unemployment. So really devastating effect on people's ability to live, to pay their bills, to have food for themselves and their families. So I list here some of the things that have occurred out of many. So there are food distribution sites across the country. There are meals that are distributed for free by some restaurants, including multiple ones in Washington, D.C. By a renowned chef named Jose Andres. Many small and large businesses, some large businesses, very large ones, have gone bankrupt. And then just recently, in the past few days, in terms of economic impact, there's been looting in some cities, including New York City and DC, Philadelphia, and elsewhere. In the United States, the income tax filing date is always April 15th. I've never in my lifetime heard of it being rescheduled or delayed, but it has been now to July 15th. So now I'd like to focus on, again, the societal events that are occurring and show a few of the images. These are from DC. This is a picture that I took yesterday. What you can see is the White House. It's across the park from a park called Lafayette Park. You can see here General Lafayette, a hero of the American Revolution, on horseback. And the park itself has now been blocked off by this approximately 8 foot, 2.5 meters perhaps, black fence that was put into place it's just yesterday, I believe, June the 2nd. And this is during the day. I haven't gone out at night to Lafayette Park, but took these pictures yesterday afternoon. There were many people there, the majority of whom were wearing masks, but of course there's not 2 meter physical distancing between protesters, demonstrators, etc. And I'd like to emphasize that the protests that are going on not only in Washington, D.C. or in certain states like New York, but across the entire country, all 50 states. And they are protests initiated after the death of a man named George Floyd in Minneapolis, Minnesota on May 25th, about 9 days ago now. And in my lifetime, my experience, this is really unprecedented in terms of such a nationwide response and protests against the death of this man who died. And it was shown on video that there were several police officials, police officers, one of whom was kneeling on the neck for 9 minutes of Mr. George Floyd, and he died as a result. These are more pictures from Washington, D.C., but from the media, from CNN. They describe peaceful protests near the White House one day after, this would have been yesterday, after tear gas, rubber bullets were fired at crowds. Again, I show this to emphasize the lack of physical distancing, of course. And again, many people are wearing masks, but not everyone. Not everyone's wearing them over their nose or over their mouth even. And again, unfortunately, in the past couple of nights ago, there was extensive looting that occurred in some cities. This is an example from the news from New York City, and curfew that was put into place there. Last night for 8 p.m. DC, it's been 7 p.m. And this is a picture I took from myself yesterday. Again, it's not something I've ever seen in terms of the police presence in this. The word police appears here, so that's why I say this is the police. The National Guard has been mobilized in at least 26 of the 50 states, as well as here in Washington, D.C. And so just to bring the connection between these images that I've shown and talking about economic impacts of the pandemic. Here yesterday in the media, CNN had this story where the Surgeon General, who is Dr. Adams, somebody I know and respect, he's warning of coronavirus outbreaks from the George Floyd protests. Again, Mr. Floyd being the man who died on May 25th in Minneapolis, Minnesota. So this is a unprecedented, unique time in the United States, not only in terms of a pandemic, a respiratory virus that's caused many more deaths than did the pandemic virus of H1N1 in 2009 and 2010, but in terms of coinciding with nationwide protests, but also this coronavirus pandemic has, as we all know, and we've experienced in Europe and in China and other places in Asia and in Iran, parts of the Middle East, and now in Brazil and Peru and Cape Town, South Africa, and elsewhere. We have no effective antiviral drug at this time, with the possible exception of remdesivir. A study in the United States showed decrease time to recovery from 15 days down to 11 days, but didn't show a statistically significant drop in mortality. No antibodies yet have been shown to be effective as treatment or prophylaxis. And I say yet because I do have some strong optimism that will be proven to be the case with either plasma-derived antibodies or monoclonal antibodies, but we're not there yet. And certainly there's no safe and effective vaccines. And I would like to say yet, but unlike influenza, we have no precedent for vaccines against coronaviruses that cause pneumonia. We never developed a vaccine that was licensed, at least to my knowledge, anywhere in the world for SARS or for MERS. So I think having safe and effective vaccines against COVID-19 is not something that we should assume is going to happen, even if we are proceeding at what has been termed in the United States Operation Warp Speed, quote unquote. There's no guarantee that there's going to be safe and effective vaccines or that they'll be available by the end of this year, let alone early of 2021. So here I'd like to stop and thank you very much for your time and questions. I think it's only about 20 minutes. It was about a 40-minute presentation, so there's time for questions. I leave my email address here. It's a Gmail, and it's daniel.lucey and then the number 8 after the Y at gmail.com. And I'd like to just close in terms of the question I've always been asked by my students over the years is, well, what's next in terms of the next epidemic or pandemic? But I think right now, the primary focus appropriately would be what's next in terms of COVID-19. June and July, summer in the Northern Hemisphere, but obviously the beginning of the winter in the Southern Hemisphere. So I think in the United States that there will be likely to be multiple so-called spikes, what Dr. Mike Ryan from the World Health Organization, WHO-OMS, has called spikes in the first wave, because of what we've seen in terms of lack of physical distancing and use of masks all across the country and in Washington, D.C. Over the last 9 days since the death of Mr. Floyd on May 25th. Another image that I have been thinking about and like to propose, but it's not a conventional one, and I don't expect it to be adopted. But rather than talking about spikes in the first wave and then debating whether there's going to be a second wave in the fall or the autumn of COVID-19, by analogy to the fall of 1918, September, October 1918 of pandemic flu H1N1 then. In my view, speaking again only for the United States, and I've tried to do that intentionally in this presentation, not speaking for places that you all know better than me, in Europe, for example, or China or Iran, but focusing on the United States, in my view, particularly now because of what has occurred in terms of the protests after the death of Mr. Floyd, the image that I'd propose for what I think is going to happen and what I think has been happening is going to continue to happen is what I call high tide and low tide waves. Like, from the ocean, you go to the beach, and the waves are always coming in. They are higher and stronger during high tide and lower and less strong during low tide, but they are continuously rolling in. And I think that, and I'm afraid that there were high tide waves in New York City and other places in the United States, in Detroit, Michigan, and New Orleans, Louisiana, and elsewhere. And now it's low tide in New York City, but I think that, and I'm afraid that the tide will start to become more of high tide with larger waves, meaning more cases and more deaths in multiple places across the United States, really all 50 states and Washington, D.C. Even now when the weather is warm, but I think that the lack of immunity, anyone on the planet having immunity to this novel virus means that it will continue to be transmitted through the warm summer months in the Northern Hemisphere in the United States. And if you look at places like Singapore in the Middle East, where it's warm most of the year, there's been transmission going on really since the cases first appeared there, with notable exceptions and successes, as we all know, in certain places like Hong Kong, and Taiwan, and New Zealand, Singapore. And so finally, I think that many people in my country, we tend to focus on America, meaning only the United States of America, the USA, and really inexplicably or unforgivably forget about the other Americas and Southern Hemisphere, South America, Latin America, the Caribbean, Central America. But as the summer arrives here in the United States, in Canada, it'll become winter in the Southern Hemisphere, and there'll be winter, what we call COVID winter. It's coming, but it won't just be COVID winter, it'll be influenza, the seasonal winter influenza epidemic that occurs in winter everywhere in the Northern and the Southern Hemisphere. So coming up later on this month into July and August and into early September will be what I call the influenza plus COVID winter in some of the Southern Hemisphere. And I'm afraid the same thing will be happening in the Northern Hemisphere in our next winter. So I'd like to stop here and take any questions or comments. And just so I don't forget, I'm going to show this next slide, the final slide that Hildegard has kindly provided with regard to the speaker next week, Dr. Emi Patel, talking about novel vaccine strategies targeting SARS coronavirus 2. So here I'll just stop, and that's next Wednesday, the 10th of June. So to go back here, thank you very much, Hildegard, for the honor and the opportunity to share with you and with members around and colleagues around the world.
Thank you very much, Daniel, for really sharing with us your view and also the insight on the COVID-19 pandemics. And let me maybe start with the first question while our listeners are typing in their question into the chat. And let me discuss with you the fear of maybe a second wave. In particular, also, as you were mentioning, if we are running maybe into winter, and then this is combined with people with a flu wave and so on, influenza and so on. So what is your view on this? You started already, but what is your view on this for the second wave and the risk? And if we are faster with having an active or passive vaccine, maybe?
So I think it's a great unknown about what's going to happen. We know most of the, I'd say the factors or the parameters that are going to go into determining how bad the second wave is. And again, in my opinion, there will be a second wave. From experience all these years going to all these epidemics, I I think that there's what I call like a sort of an operational truth. In other words, you have to prepare and take action for events that are likely to occur, especially if they have major negative impact. So if there is no second wave, I'll be the first to say I'm very happy and I'm wrong. I was wrong, but I can't imagine that happening. And most importantly, we have to prepare for it. So I think most people in the world agree with that, and most governments, most public health officials. So there's this tremendous race to develop vaccines with more than 100 candidate vaccines. And this Operation Warp Speed, quote unquote, in the United States, but at least 5 candidate vaccines have entered human trials in China, and several in Europe and elsewhere in the Americas. So in developing antibody treatments and prophylaxis and drug treatments and prophylaxis. So I think there will be a second wave. My view is that, especially because of events that are ongoing now in the United States, the second wave, I think, will be what I would just call the peak of the high tide of waves. There's not going to be an absence of new infections or waves of infections in the United States between now, June, and November or December. That's what I would anticipate, and I think we should prepare accordingly. But also, I think it's very important just to pay close attention and learn lessons, and to try to contribute to fighting the pandemic in the Southern Hemisphere. Again, because what's about to happen in the Southern Hemisphere, I anticipate, and again, I hope that I'm wrong, but that there's influenza plus COVID epidemics in June, July, August, and September in the Southern Hemisphere. Much like influenza goes back and forth between the Southern and Northern Hemisphere every year, but now it's going to be influenza plus COVID. And since they have overlapping symptoms, some are different, obviously, but overlapping symptoms, all the more difficult to distinguish them clinically, and the more need for laboratory testing, which, as we all know, has been a tremendous problem in the United States. I'll just, again, speak for only my own country. So I'll stop there.
Thanks. We have received a question from Axel Schambach from Hannover Medical School, and he's asking, what are the lessons learned from your point of view to prevent dissemination or worldwide distribution of future pandemic virus outbreaks?
Well, I appreciate that question from Axel, because again, I focus on what's next with regard to this particular virus and pandemic, because I think it's so very almost overwhelmingly important. But at the same time, my whole career, I've always tried to anticipate what's next in terms of the next major outbreak. And the reality is there's obviously epidemics going on all the time around the world of many diseases, and including non-infectious diseases, but focusing on infectious diseases, not just viruses. But I've even advocated for use of the term disease Y. So as we all know, World Health Organization and others have talked about a disease X, which COVID-19 is disease X. But I believe that we should be preparing for disease X and disease Y. There's no reason that nature's only going to show us one terrible new disease at a time. So if COVID-19 is disease X, well, what's disease Y? So I think we have to remain very, very vigilant. And so lessons learned are that there are overlapping new diseases that occur sometimes. For example, in March of 2013, there was H7N9 avian influenza being reported from Eastern China and other parts of China. At the same time, the Middle East respiratory syndrome coronavirus was being recognized more and more in parts of Saudi Arabia and other parts of the Middle East. So I think that worldwide collaborative surveillance for another major epidemic or even a pandemic to begin now, or maybe, as I always like to say, is what's next is already here. We just haven't recognized it yet. But how do we recognize it? We have to stay hyper vigilant. And despite all of the epidemics that are ongoing and this COVID pandemic, there's as we just heard about in the past 2, 3, 4 days, another outbreak of Ebola in the Democratic Republic of Congo, although in the Western Equator province, not in the Eastern part of the country. So I think that despite this COVID pandemic straining the resources of the world in a series of waves, we have to remain really vigilant or hyper vigilant as an international community for what's next, because maybe it's already here, even though we haven't recognized it yet. And if I could tread out on thin ice, that I hear the ice cracking as I speak, but I want to say that in my own opinion, it's very important for the United States to remain a part of the World Health Organization and to support it in every way that we have up until now. And I say that as someone who's been personally, I've been critical of World Health Organization in terms of their response to Ebola and the timeliness of responding to other epidemics, Ebola in West Africa, that is. But I think it's in the United States' best interest and as a part of the global community that we should remain a member, active member, as we have been since the formation of the World Health Organization. I'll stop there.
Thanks, Daniel. And so if you now look back into all the epidemics you have seen and also into now COVID-19, so is there anything what you think, absolutely personal opinion, but what you think could have been or should have been different, or should have been so that people communicate or do otherwise than they did? I know afterwards you always, know how it works and so on, but when you now with your experience look back on how the pandemic evolved, is there anything what you think could have been done better than the people did?
So I mentioned last minute ago, I heard the ice cracking as I'm walking out onto the lake. And now I think I'm starting to fall into the freezing cold water, but thank you for the question. And honestly, I feel it's my personal possibility to answer the question from my own, my own opinion.
It's meant also in preparation of what is coming up, because I mean, here we really, for me, it was the first time really that we observed that a new virus really happened and it's affecting all of us. And in my opinion, and this is what I learned from science, really science in gene and cell therapy, it's always a team effort across nation. We have to work together to make gene therapy a reality. And I think it's the same with the virus spreads. And therefore I was shooting this question to you.
Yes, so I, Hildegard, agree with you 100%. I think that it's a global response that's needed, but who makes up the global response? It's individual nations and organizations like WHO, OMS, but then who makes up the organizations? It's us, it's individual people around the world. And it's not just scientists or medical people, it's really all of society. And now we've seen the impact across all of society of the pandemic. And again, I've tried to focus on some aspects of that in the United States in this acronym SPELL, S-P-E-L-L. But I think that there hasn't been the sufficient, adequate cooperation really from the beginning. And I certainly include my own country, and there's the cracking ice and I'm falling into the cold water, but it's the truth. And I think it's important to speak the truth in part because of there will always be more epidemics and pandemics, and including in my lifetime and certainly in lifetimes of my children and others who are on this call who are younger than I am. So we have to prepare better. So very briefly, I just say that since the night of December 30th in the US, December 31st in China, I've been following this story because for me, from all the years of it, going to epidemics and particularly from SARS in 2003, I was very concerned. And also the first information coming from a physician who is warning his ex-medical school classmates and colleagues that there could be a new SARS pneumonia. To me, that's very, very worrisome. I haven't heard of that occurring, since 3. And so I gave it a lot of credibility. And I think some other people did in China and other parts of East Asia. And I understand there's always politics involved, but to some extent, I think it's the responsibility of individuals to do the best that they can do. And I think that it hasn't been good enough, obviously, in this case, because there is a pandemic, and it's going to be much worse, I think, as it continues, in the months ahead, including in the Southern Hemisphere and in the winter that's coming. And the last thing I was to say personally, I have been following every day. It's been more than 155 or more days now, and in the very beginning. I was already scheduled to give a talk at the United Nations on Tuesday morning, January the 14th. This was on the 5th floor of the United Nations in New York City, and it was a webinar. So it went out to over 200 United Nations email addresses, people around the world. It wasn't a presentation to people in the building. And so the topic that I was talking about, I had to give the title in November, and then it was sent out by email December 23rd. And it was lessons from SARS for the next lethal respiratory pathogen causing a rapidly spreading pandemic. And that wasn't a phrase that I came up with. It was a phrase that the Global Preparedness Monitoring Board, it's co-chaired by Dr. Gro Harlem Brundtland, a physician, former Prime Minister of Norway, former head of World Health Organization, Director General during SARS, had come up with. And so I mean to say that others were concerned about a potential pandemic that wasn't just due to influenza and taking some action. But in my presentation, I just want to emphasize that for me, I lined up the information side by side, SARS versus 2003 versus this novel coronavirus, because that's what it was still called. And so the red flags for me were, is there person-to-person transmission? Are healthcare workers getting infected? Are there super spreading events? And at that time, the best public information that I could find was officially the answers were no to those questions. But in fact, they were yes in reality. And those were tremendously loud warning signs, or they would have been if we had known that. So I think we have to stay very vigilant for what's next, because what's next is perhaps already here, but we just haven't recognized it yet. So we have to not only recognize it, but take appropriate, immediate, comprehensive, and sustained action. So I'll stop there for that question. Thank you.
And so as last question for today, I would like to go back to the vaccine topic, because this is really an effort which is now ongoing worldwide, be it a passive or active vaccine. What is your view on that?
Well, I think the context is that we haven't, ever had a vaccine against the SARS or MERS coronavirus pneumonias. So it's quite different than influenza, where past is prologue. We've developed influenza vaccines quickly. So, but there's tremendous competition and funding, and obvious important, crucially important need in order to save people's lives. But also to preserve and we strengthen economies around the world. And there's many more deaths that will occur because of COVID pandemic, but not directly due to COVID or to that virus, but because children can't get vaccinated against vaccine preventable diseases, because healthcare systems are destroyed, or much like West Africa in Ebola in 2014, people don't have adequate, or in some cases, any personal protective equipment. Many healthcare workers are being infected and dying. So we need the vaccines and the passive protection prophylaxis, if you will, by antibodies, whether it's plasma-derived polyclonal or monoclonal antibodies, of which many are being developed from Europe, from China, from the US and elsewhere. So I'm hopeful because of this international effort. I can't say that I'm optimistic. That's partly maybe from being so old and seeing so many epidemics and seeing how badly, in my view, this one has gone so far. I think there will be vaccines later this year in China, one or more. I do believe that. And Dr. Gao spoke on May 23rd. He also said that there may be specific high-risk populations in China that give consent to receive, the initial vaccines. I presume he's talking about healthcare workers and others, although he didn't specify. So I think there's this tremendous need to collaborate internationally. Obviously, you've heard certain things from my country about lack of collaboration on vaccine development. The United States did not participate in the big collaborative meeting recently in Europe with regard to funding, with regard to vaccine development. I think that's really, really, really unfortunate for my country and for the world, but I can't change that right now or really ever. So I hope that by working with colleagues like yourself and your group, Hildegard, and others who are on this webinar, that there will be safe and effective passive, active prevention against this pandemic as soon as possible later on this year and the months ahead in 2020 and certainly into 2021. But I think we have to remember that there's 7.7 billion people in our species on this planet. And when we say, well, there's going to be a vaccine later this year or early 2021, it's not going to be for all, it's not going to be available for all 7.7 billion people, nor are the monoclonal antibodies or even the plasma-derived antibodies. So I think that's the reality, and it's our responsibility as our role in this time in history to do the very best that we can. But what we need to do is develop synergies of strengths. By working together, we can accomplish much more than we can as individuals or as by individual nations. So thank you very much for this opportunity to be on the webinar today. And I look forward to hearing future presentations, and I'm glad to communicate by email with anyone who's hearing the presentation today. Thank you so much.
Thank you very much, Daniel. And these were fantastic words to end this great seminar. Thank you again for sharing with us your view on the COVID-19 pandemic. And to all of you, we also invite you for, as Daniel already announced, to the next week seminar on the novel vaccine strategies. Thank you very much, and bye-bye.
Sure. Bye-bye.